Welcome to OncoSure testing, where innovation meets early detection. OncoSure provides a comprehensive, blood-based cancer screening solution designed to detect over 200 human cancers across every stage. OncoSure testing is recommended for adults at risk of cancer, especially those with a family history, genetic predisposition, or other contributing factors. The test is designed to complement traditional screening methods and enhance early detection. OncoSure follows strict validation standards established by the American College of Medical Genetics and the Clinical and Laboratory Standards Institute to ensure precision and reliability. Cancer risk increases with age, as shown here by incidence rates across age groups. These trends highlight the importance of proactive screening, especially as patients enter higher risk ranges. OncoSure's performance speaks for itself. Our proof-of-concept studies demonstrate 98.44% sensitivity, 97.15% specificity, and 97.77% overall accuracy. This high level of precision means fewer false positives and negatives, giving providers confidence in their clinical decisions and patients peace of mind through clear results. OncoSure's advanced technology detects cancer at every stage, from precancerous cellular changes to later-stage disease. We screen for all major cancer types, including ovarian, prostate, liver, colon, pancreatic, and more. By identifying the earliest possible signals, OncoSure empowers providers to act sooner and improve patient outcomes. One of OncoSure's greatest advantages is simplicity. No fasting or special preparation is required. Each patient receives clear instructions and informed consent is obtained before their blood sample collection. Our goal is to make cancer screening as seamless and stress-free as possible. Every step, from sample collection to final analysis, follows strict laboratory protocols. We ensure accuracy through regular equipment calibration, ongoing staff training, and comprehensive validation and verification processes. We also participate in external quality assurance programs to maintain industry-leading standards in performance and reliability. Once a sample is received, analysis begins immediately to ensure rapid turnaround. Results are typically communicated within 24 hours after the sample is received by our lab. Using fluorescent microscopy, OncoSure identifies and quantifies oncosomes, which are cellular particles associated with tumor activity. Results are reported clearly and directly, giving healthcare providers the information they need to guide next steps. Our testing process goes as follows. Each participant completes a telehealth appointment and questionnaire, followed by a blood draw. Samples are then shipped to our laboratory and processed. If a cancer signal is detected, confirmatory diagnostic work is done to determine results. If no signal is detected, patients should continue with routine, guideline-based screening. Regular monitoring remains key, even for negative results, to maintain long-term health awareness. OncoSure detects the presence of oncosomes, extracellular vesicles that are often associated with cancer cells. Oncosomes carry molecular cargo, including proteins, RNA, and lipids, that can influence tumor growth, metastasis, and immune evasion. Because of their strong association with cancer-related processes, oncosomes serve as valuable biomarkers for early detection. Several biological processes can influence the presence of oncosomes, including tumor growth, metastasis, inflammation, hypoxia, and even certain cancer therapies. While they're often associated with cancer cells, it's important to note that other cells, such as those involved in inflammation, can also release similar vesicles. By identifying and analyzing these oncosomes, OncoSure provides a non-invasive, real-time snapshot of a patient's cancer status, helping clinicians detect changes early and support proactive care. As we look at oncosome levels over time, distinct patterns begin to emerge. Benign or reactive cases show fluctuating counts that rise and fall with inflammation or metabolic stress, while malignant patterns increase steadily over time, a sign of possible tumor progression. Stable high levels may reflect chronic cellular stress rather than cancer. Oncosomes exist in both healthy and cancerous cells, but cancer-derived oncosomes stand out. They are typically larger, more numerous, and carry tumor-promoting DNA, RNA, and proteins. Because they circulate in blood, they serve as non-invasive biomarkers that reveal tumor activity and treatment response. When patients undergo treatment, oncosome levels can reveal how the body and tumor are reacting. During chemotherapy or radiation, there's often an early spike, a stress response as tumor cells break down or repair. If treatment is working, those levels soon decline. If they remain high or continue to rise, it can suggest treatment resistance or ongoing tumor growth. Here we can see how cancer-derived oncosomes differ from normal vesicles. Healthy cells produce small, stable vesicles for communication and repair, while cancer cells release larger ones packed with oncogenic material and tumor markers like HER2 and EGFR variants. Tracking these vesicles gives clinicians a non-invasive way to monitor disease progression and therapeutic response with precision and speed. Chemotherapy causes only a minimal effect on normal vesicles, but triggers a temporary spike in oncosomes as a stress response, followed by a decrease when treatment is effective. Radiation has a similar pattern. Damaged tissues may briefly release additional vesicles due to inflammation and DNA damage. Then levels decline once tumors are under control. By tracking oncosome trends, clinicians gain a powerful non-invasive method to assess cancer presence and monitor progress over time. An initial increase followed by a decline indicates effective therapy, while persistent or rising levels may point to resistance. By identifying circulating oncosomes and cancer-related biomarkers, OncoSure provides an early warning system that often detects changes before imaging or symptoms appear. It's non-invasive, repeatable, and allows for ongoing monitoring without adding stress or risk to the patient. Every patient's cancer behaves differently, and OncoSure supports that reality. By tracking individual tumor responses, providers can tailor treatments to each patient's biology, minimizing exposure to ineffective therapies. It empowers clinicians to make faster, evidence-based decisions, while improving the patient experience through less invasive, more personalized care. Beyond cancer detection, OncoSure integrates pharmacogenomic testing to personalize medication management across multiple specialties. These panels analyze genes that affect how patients metabolize or respond to specific drugs, from pain management and anesthesiology to cardiology, endocrinology, neurology, and psychiatry. By understanding these genetic relationships, physicians can select medications and dosages that maximize benefit and minimize risk. Our pilot program brings OncoSure testing to a large population, projected to be 975,000 patients over 6 months. Comprehensive molecular and genetic screening identifies individuals with abnormal oncosome counts, classifying them as high risk. Those patients are then retested every 60 days to ensure ongoing monitoring and proactive intervention. Through this model, the program aims to identify more than 100,000 high-risk individuals for early management under a value-based approach. This continuous cycle of screening and follow-up allows for early detection, fast response, and ultimately better patient outcomes.